I'm trying to figure out what we're doing. We looked at coming up with a staffing ratio for nursing homes, and you set the staffing ratios. And my understanding is the staffing ratio that is being set by the rules and regulations from DPH is different than the staffing ratio that we called for in the budget, because we put a financial number on that staffing ratio. And this is going to cause an increased cost to nursing homes. And so to the working group, if you wouldn't mind bringing back your analysis and what you came up with as a result of a fiscal note, because by my analysis, we would have to at least increase the fiscal note by half. And so I just want to make sure that if that's going to be the case, that you're also supporting us putting the dollars in for the nursing homes to comply with the staffing ratio you're setting up. And it does not appear to be so right now. You may have a different analysis, and I appreciate looking at that, but that is not what I see right now. So if you wouldn't mind bringing that to the working group, I'd appreciate it. Thank you very much, Madam Chair.
If I can just make one comment on that, the fiscal note really would be DSS because we don't do that piece of it. What we're operationalizing is the 3.0 request that the legislature put forward.
And we did a combination, and you're separating it out, doing LPNs under the CNA numbers. Your numbers are much higher than the numbers that we have. And while I appreciate that you don't pay the nursing homes, if you set a rule or regulation that increase the cost of the nursing home, that has to be part of our consideration in accepting those rules changes. And that's what I'm concerned about, because the only money they get, group homes, nursing homes, the only money they get by and large is from the state through Medicaid. Very few private payers in any of this. And if we're going to increase their costs, even though that is not your responsibility, I think there needs to be a collaboration, because your analysis increase their cost. If you increase their costs, then we need to know about that. And if you're not talking with DSS, we're not going to know that. We happen to know it because as soon as you did that, the increased costs came to our attention.
We've been in direct conversations with everybody in the industry and DSS. I just want to highlight that our goal and our understanding from the law, the way it was written, was to increase facing time with patients. And that goal was to provide care to patients. And just to highlight, even increasing to 3.0, it is the lowest out of our surrounding states.
I'm not saying that we shouldn't do this.
I'm not sure that our focus is quality of care. That's all.
I understand that that's your focus. I'd like to do everything as quality of care for everything that comes before me. Everything that comes before me has a fiscal note, and I have to say no to people that want to do things. I have to say no to educators. I have to say no to firefighters. I have to say no to ambulance services. I have to say no to group homes. You can't have a rule that increases their costs without us knowing about it, because that puts them in a very difficult position, and it puts us in a difficult position because we have to incorporate that cost into our budget. And that's my concern. And I don't want any agency coming to me and saying that they're concerned about quality of care when I'm also concerned about quality of care. I have to pay for it. All of us here are paying for it. And so to say that, I find that to not understand the process, and that worries me. So if you wouldn't mind bringing your analysis to the group, that would be great. Thank you. Thank you, Madam Chair.